Hello guys. So I've seen quite a few dental stories on YouTube, and I want to give you a few hints and tips on how to keep your teeth like really shiny and cavity free. So I am a former dental nurse. So I have been in dentistry and I have picked up quite a few helpful tips and tips how to keep your teeth spotless. So day and night for 2 minutes or maybe even 3, or listen to your favourite song whilst you are brushing your teeth. That usually helps just to get things in, makes more things more fun. And then what I do is I use an electric toothbrush from a well-known brand, and I brush not only my teeth, but I brush like on my gum line, so like around here as well. And I don't scrub, I just use the brush slowly because it's the brush doing the work, and then I don't have to do much work as the brush is going over my teeth. So not only that, I then floss, which I floss lowers and uppers, and I find that when you get to your 6th, 7th and 8th, here around here, and you floss and then smell the floss, it will smell, depending on your oral hygiene, it will probably smell either really bad or not so bad, but it smells like bad breath. So if you get rid of that, and if you do suffer from bad breath, then flossing may just reduce that bad smell. So you floss and then you use your mouthwash. Don't use your mouthwash before you floss, before you floss, because you're bringing up your plaque and food that's been like stuck between your teeth, and that's going back all around your mouth. So when you use your mouthwash, you are rinsing it around your mouth and spitting it out. So if you don't want to floss or use mouthwash, that's entirely up to you. Then you can do something else. You can use a fluoridated toothpaste, and that can really help with gingivitis, periodontitis, and it also helps protect your teeth from other bacteria. But when you brush, you spit your toothpaste out, but don't rinse. When you rinse, you are taking away the fluoride from your mouth, and you are more prone to getting bacteria back into your mouth as soon as you eat. So if you've got toothpaste that still lingers around, it can help fight off the bacteria when you're eating or drinking. And if you find that you're getting like sore gums and maybe even bleeding from the gums, then there are mouthwashes and toothpaste that you can use to help cure that. But also using a dab of fluoride toothpaste on the gums and the area that's hurting can also help with the pain and the soreness and so on and so forth. Also, when eating sugary foods, as soon as you eat a sugary food, your mouth goes into an acid attack. That means acid, the sugar gets in your teeth, and there's acid to help that builds up, and it causes decay and early caries and so on and so forth. So if you've eaten anything sweet or drank anything sugary, then it's best to either have a bit of cheese or drink some milk to neutralise that acid, and neutralise that acid wear that you may get with sugary products. So, and for young children, it's usually best to keep sugary snacks and sugary drinks with the mealtime to help your child to get in that pattern of not eating sugary snacks throughout the day, which can cause really bad teeth in young children. But I will say that what I say is not at all in a professional, it's not professional. I mean, it's just my own advice that I'm giving to you, so you could either take it or just whatever. But yeah, so keep sugary snacks in between, not in between meals, but at dinner, and that's it. You can buy disclosure tablets, which you can get from any sort of like chemist or health shop, you know, healthcare, places like that. So you get these tablets are small. You can get like blue and pink, whichever colour, and you put them in your mouth. They don't taste too good, but they don't taste horrible. You chew them up, and as you chew them, the spit makes like a fluid that you can rinse around your mouth, and after about 30 seconds spit the fluid out of your mouth and look in the mirror, like, look around her, and it will show up any plaque that your child or yourself have missed, and it can help you reduce going to the dentist as you are taking care of your own teeth and making sure you've got all the plaque and all the bacteria from your mouth. You can do it before you brush, so you can brush it away and make sure that you've got all of it, or you can do it after you brush, so you can see where you're missing or you're not brushing as much, and then that can really help. So I won't blabble on too much, and I hope you enjoy my video, and take care.